Assalamualaikum and hi, I'm Sarah, metric number 144192 from LSP 404 Group 259. I want to share about a very rare skin disorder which known as xeroderma pigmentosum. Have you ever watched a movie named Midnight Sun? The story tells about a 17-year-old girl which suffered from xeroderma pigmentosum. So basically, the person who suffers from this disease is very sensitive to ultraviolet rays from sunlight, has premature skin aging, and is prone to develop skin cancer. Xeroderma pigmentosum is an inherited disease which happens due to defect in the DNA repair system. The symptoms may differ for every person, but the persons who are affected by this disease usually show the sign around the eyes area, skin that is exposed to sunlight, and also may involve their nerve system. For eye effect, XP patients may develop dry eye, which will show symptoms of inflammation and redness. Dry eye can result to keratitis and chronic inflammations. In severe cases, keratitis can result in corneal opacifications, which is the lack of transparency, and vascularizations, which is an increase in blood vessel density. This combined effect may obscure the vision and result in blindness. With repeated sun exposure, the lids of the eye may degenerate, eyelashes may fall out, leaving the eyes unprotected and lead to vision loss. For a skin effect, XP patient will develop blistering burns on sun-exposed skin after minimal sun exposure, usually less than 10 minutes exposure of the sun. The burns may take more than a week to heal. However, 50% XP patients' skin will tan instead of burns, but both symptoms result in early onset of freckling or named as lenticles of the skin. Lenticles are a sign of unrepaired UV damage in the skin. Repeated sun exposure also results in xerosis, which is a dry, parchment-like skin, and poikiloderma, which is a mixture of both hyper and hypo skin pigmentation. Skin atrophy, and skin atrophy is a thinning of the skin tissue, and telangiectasia, which is a widening of the small blood vessel which produce red lines and patterns on the skin. Furthermore, repeated sun exposure may have severe effects such as skin cancer. Meanwhile, the symptoms of the neurodegenerations include which is a quiet microcephaly. Microcephaly is a condition marked by the smaller head size and structural change in the brain. Diminishing or absent deep tendon reflex progressive high-frequency sensorineural hearing loss, which is a deafness caused by damage to the nerve of the inner ear, progressive cognitive impairment, spasticity, which is a tightness or rigidity of the skeletal muscles, ataxia, which is poor muscle control and coordination, seizures, and the difficulty of swallowing, or vocal cord paralysis. At present, there is no cure for XP disease. However, there is some prevention the XP patient needs to follow. This including visiting dermatologists every 6 to 11 months so they can check if there is any symptoms of skin cancer, The patient also need to have regular vision, hearing, and neurologic exams. People with XP should reduce the exposure to UV light as much as possible. The common source is sunlight, so it is crucial to wear protective clothing, including hoods, gloves, and UV light blocking face shields, sunscreen, and protective sunglasses when going out. People with XP should take vitamin D supplements since sunlight is the primary source of vitamin D. That's all for me. Thank you.